Welcome to Round 18 Group 2 Listserv discussion about mental health and well-being in medical education.
Mental health and education. Mental health is a rising issue that is receiving more attention lately. Studies show that 20% of kids in the United States show signs or symptoms of a mental health disorder. These issues include depression, anxiety, and substance abuse. Unfortunately, a large percentage of these children are not treated for their disorders and go undiagnosed. Many children who face mental health issues have troubles that tie into problems at school such as constant absence, failing grades, and unruly behavior. The first step in finding a solution to this growing epidemic is to start at the root of the problem. Students that show signs of mental health issues should be helped immediately. Teachers should be aware of signs that their students may be dealing with mental health issues and make an effort to reach out to help. Their parents should be made aware of the potential disorder and a joint effort should be made to help them. Meetings with guidance counselors and therapists should be scheduled to give students a safe place to talk about their feelings, troubles, and thoughts. This will allow students to talk through what is causing their mental health problems and hopefully a resolution can be made. Lastly, it is important to remember it takes a village to help.
Due to the importance of this topic, we have selected it for the upcoming Listserv discussion in the JMHPE. This discussion focuses on the importance of mental health in medical education. Students' academic and social success can suffer as a result of mental health issues. Education systems around the world approach this topic differently, both directly through official policies and indirectly through cultural perspectives on mental health and well-being. The group mentors are Dr. Enji Abozaid and Dr. Hadir Adel. And our group members consist of Dr. Mohammed Saad, Dr. Iman Sharif, Mrs. Noor El Salat, Dr. Iman Awais, Dr. Lubna Khalifa, Dr. Iman El Wakil. This discussion runs through the dates from the 25th of June till the 7th of July with each member discussing their theme across those days. Starting with Dr. Mohammed Saad. Mental health and well-being. Investigate well-being and mental health in medical education. Describe factors affecting mental health of medical education aspect. Common mental disorders. Identify the common mental health signs among medical students and physicians. Stigma of mental disorders. Discuss common mental health disorders among medical students and physicians, for example, anxiety and OCD, bullying, depression and mood, ADHD. Investigate the stigma of mental health among the medical sector. Dr. Iman Sharif. Debate students' mental health and well-being during COVID-19. Discuss the impact of online learning on students' mental health and motivation. Mrs. Noor El Salah. Discuss the impact of mental health of a student-teacher on educational progress. Discuss the impact of mental health on the relationships of the students, teachers, and both. Dr. Iman Awais. Discussing the factors that may impact the mental health of postgraduate students like employment stress, clinical work, research pressure, and absence of mental health education. Discuss proposed solutions and countermeasures to reduce the impact of these factors through medical education programs. Dr. Lubna Khalifa. Identify the role of universities towards students' mental health, stress, factors, student well-being. Explain how to support students' mental health. Student support groups. List the academic consequences of mental health problems, burnout, dropout, academic procrastination. Dr. Iman El Wakil. Explain self-regulated learning and its relation with mental health. Discuss the student success measurement resilience and its relation with mental health. Dr. Iman Awais. Final report. Thank you for your support.